We're talking to Dr. Eric Westman from Duke University, and of course we're talking about some of the problems of lifestyles and lifestyle changes that might enhance an individual's health. And of course, Doctor, let us allow you to continue our discussion here.
Great. Well, this has been very, very informative for me too. Thank you. I would like to switch gears a little bit, and while I manage weight, and the bariatric physicians are weight management physicians, weight change should be the first thing you think about with diabetes. And so I'd like to spend this last segment on type 2 diabetes and obesity, what you could do at home, you know, tips for people whose doctors aren't giving them the right information and all that. But I'd like to point out that what we do in our clinic is nothing new. In fact, I understand you're a bit of a history buff yourself, and during my first study that I did with the low carbohydrate diets, a patient of mine brought in this book. It's a book from 1923 from the Appleton and Company, the late Sir William Osler. You recall William Osler as an internist, wasn't internist, kind of the father of internal medicine. Well, this patient brought it in, knew I might be interested, and I was doing this study that nobody really thought very highly of at the time. It was low-carb diet. But you'll see here for the type 2 diabetic, now this is before insulin was available. 1921 insulin was discovered, and then it was put into practice pretty quickly, but this was before insulin. And the quantity of food required by a severe diabetic, weighing 60 kilograms, so about 130 pounds, was 10 grams of carbohydrate per day. And I looked at this in my clinic when the study was going on, and I thought, well, I'm telling people to eat these foods. I'm telling them to eat asparagus, Brussels sprouts, cauliflower, broccoli. And here, that's what Osler said people should do. So
the man responsible for internal medicine.
For internal medicine, that's right. Well, so they didn't have insulin available at the time. They didn't have these pills and all that. So all we're doing is we're giving people the option of using the knowledge that was gained before all these medicines were available. So if you trace the teaching over time, and this is from 1952, the diabetic ABC, you'll see that there's a little bit of loosening, although protein and fats are at the top, animal food and fats, butter is fine, cream, olive oil, you know, is still hot today. And you can have unlimited amount of low carbohydrate, starchy vegetables, but you limit the potato, the size of a hen's egg should be the size of the potato, so the starchy vegetables are reduced. But now in 1950, doctors were able to use insulin, and so they allowed the diet to become less strict and use insulin. The problem today is that diabetes, type 2 diabetes with obesity is still a very bad disease. So all it takes is one family member who goes on to dialysis, has blindness, has amputations, for some other family member to know that this is something you don't want. And so the lifestyle program that we have just takes people back to what was known before all of the drugs and all the other things that are available. So things that you should think about at home are no sweetened beverages, please. No sugar in the beverage. I can get my diabetics to get a little bit better just by having them change from sweet tea to unsweetened tea, or using a sweetener like Splenda or aspartame, something like that. Other things to watch out for are those fries. So if you make that fast food, you supersize it or whatever it's called in whatever restaurant, those fries make your blood sugar go up. So remember that potato was limited, and even
the size of a hen's egg.
Or even before that, you didn't have any potato at all back in 1923. So what's really exciting is that by making these changes, you can influence the diabetes. You can make it better. And also you're losing weight. So the diet and then the weight are both a factor for type 2 diabetes when you have obesity. And so you've got to lose weight. You've got to do everything you can. And if your doctor's not responding, I can suggest the American Society of Bariatric Physicians, because they'll respond. We train them in this approach. They use appetite suppressants, that sort of thing. And that's beyond Duke. That's all over the country. It's a great organization. We call it the ASBP for short. But you have to control the carbohydrate, the sugar going in the body, and then also the weight on, you have to have the weight loss, so that ultimately you can take diabetes away. You can't.
Well, what about childhood diabetes? That's one of the real problems that we've had in this particular area.
It's a big problem, and it's more complicated because you have a family. You don't just have one person in the clinic.
Okay.
So, you know, that's tough. But the same equation occurs, so that if you're eating too many calories, and if the calories are from sugar, you have to reduce the sugar. So I like people, my other dream is that to lose weight, you don't just decrease the fat. Everyone says, oh, I know I need to decrease the fat. No, no, no. If you're eating too much sugar, you have to decrease the sugar. If you're eating too much potato, you have to decrease the potato. So the pediatric obesity is a big problem, and we're seeing diabetes in children, and the pediatricians don't know how to manage it. So at Duke, we have a specialty center for pediatric obesity and diabetes now. So that's a bad sign. It can be turned around by attention to what goes in the mouth, the food and the drink. But you know, if you have ever had a teenager, the battle is a little harder than as an adult, just treating one patient.
You know, Doctor, in looking at some of the major issues that you find in treating diabetes, what would you say would be the national impact of these diseases upon our national budget? If we were able to eliminate these as diseases, how would that affect our budget?
Well, there have been, it's tens of billions of dollars in healthcare costs. I don't know the figure exactly, but it's
But that would
huge.
be a real cost. We would be able to. What about dialysis? How much does it cost to keep an individual perhaps over?
Very expensive. I think $25,000 to $50,000 a year. So if you can avert one dialysis patient or delay it, this is a very important way to save money.
And of course, when young children get caught up on that and they have to go on to dialysis, they have to go on at an earlier age.
Well, this is the fear. Now, I don't know of those cases yet, but that's the projection, that we'll have people on dialysis at early and early ages because of the diabetes.
And so there's nothing that, well, is it just education that we have to continue to pump at people in reference to these diseases? What, you know?
No, there's been a lot of education. You know, this has occurred with people who are working hard, working at this. It's kind of like smoking. It's complicated. There are the environmental things that have to change, so that you can't have all the calories available everywhere. When I grew up, we didn't have vending machines everywhere. And now it's so easy to get that. The type of food matters. I just want people to go back to eating real food. You know, food that doesn't come in a box, in a package, with processing, that sort of thing. And then they're going to be a lot healthier.
Very good. And of course, your clinic is devoted to that, and it's working off of a grant that you received from the Atkins Foundation. Is that?
We use grant support, but also insurance is paying for this now. That's the other thing doctors need to know, is that insurance is coming around, and you can actually treat people this way and get reimbursement for it.
And so there was some fear that that the insurances would not pay for that kind of treatment?
For many years, they did not. And if you just put obesity down, you wouldn't get paid at all. So that's a big issue, and that fortunately is changing.
Well, it would seem to me that if a company is involved in insurance, what they would want to do is to prolong life as long as possible. And if it does appear as if there's something that you could do by way of diet in order to prolong life, they ought to be in favor of doing everything that they possibly could to cut down on obesity, the sugar, and et cetera, and et cetera. It seems to me, Doctor, and again, I'm not on a soapbox here, but it does seem that if our medical people are not doing us a great service unless they talk about these kinds of things, you see. And I don't, you know, I'm not charging anybody or whatever, because I think that we see too much information on the television every day about diets and et cetera and et cetera. And so the population is aware of what the diet is doing in terms of their appearance. They might not be aware of the health, and I think if we could bring that health and appearance thing together, we might be more successful in doing so.
Well, that's the idea of merging lifestyle medicine in the name of a clinic, because we're talking about medical problems, diabetes, kidney failure. These things are serious and
Very
costly.
good. And of course, Dr. Let me thank you for coming by and giving us that excellent information. And as we said before, we know that our audience will be informed by some of the things that we've talked about. And of course, let me also encourage our audience to tune in again next week for another informative edition of Comments. Thank you and